Health and Human Services in the Region 5 Office of the Assistant Secretary for Health. Region 5 covers the 6 states of Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. On behalf of my office and my partners, the Illinois Alliance to Prevent Obesity, thank you all for joining us for today's webinar, The Role of Physical Education in Enhancing Adolescent Mental Health. Monday kicked off National PE and Sport Week, and throughout the month of May, we'll also recognize National Sports and Fitness Month. We have some outstanding presenters today to discuss the impact of physical education and physical activity on adolescent mental health and well-being, and to showcase work that has taken place in Illinois focused on adoption of enhanced PE policies. Before we begin, I'd like to draw your attention to some important webinar logistics. Today's webinar is being recorded and you are currently in a listen-only mode. Use the question box to submit any questions throughout the session. We will designate time at the end of the webinar to answer as many of your questions as time allows. A link to the audio recording of the entire webinar will be sent via email in the next week. A little bit of background about my office. In early 2016, we established the Region 5 Adolescent Health Network. The regional network addresses a myriad of adolescent health issues, and we've designed this year's programming to focus on topics related to mental health and well-being. This slide includes details on how you can sign up for our email listserv to receive updates. May is also National Teen Pregnancy Prevention Month. Visit this web link to learn more and find ways to get involved. We'll be hosting a webinar for NT-PPM next week, listed here. Contact me or sign up for our listserv for more information. I would also like to acknowledge our sister agency, the HHS Office of Adolescent Health. OAH leads Adolescent Health Think, Act, Grow, or TAG, a national call to action that aims to raise awareness about the importance of adolescent health, engage stakeholders, get adolescent health on the national agenda, and to spur action through a comprehensive, strengths-based approach. You can learn more about the Office of Adolescent Health and TAG by visiting their website and signing up for their e-updates. I'd also like to highlight a number of resources that may be helpful to you focused on physical activity, PE, and the health and well-being of young people. The Physical Activity Guidelines for Americans, which has a second edition currently being developed and is expected to be released in 2018, is and will continue to be a helpful tool for all working in PE and youth sports and fitness. The Centers for Disease Control and Prevention School Health Profiles surveys schools across the country on their PE and physical activity policies and practices, and you can review their reports, as well as CDC's data and materials focused on the linkages between youth academic success and their health, noted here. As mentioned previously, Region 5 covers 6 states. I will very, very briefly highlight the PE policies of each state, both for your information, as well as to demonstrate how different states and even local policies can be in PE. I'd like to note that this is an extremely complex issue and many details won't be covered, such as exceptions, local or school-based decision-making, and I will also not present information on physical activity policies, such as recess or school sports programs. So Illinois requires that all K through 12 grades have a minimum 3 days per week of PE. However, there are some individual and school waivers available. Indiana requires that elementary schools and middle schools have curriculum that develops students' knowledge and skills based on the academic standards in health and wellness and PE. And Indiana's high school students are required to take PE and earn at least 1 credit to graduate. Michigan's PE state policy requirement is that high school students have at least 1 credit in subject matter that includes both health and PE to earn a diploma. And Michigan also has a model policy that recommends instructional PE totaling 150 minutes a week in elementary schools and 225 minutes a week for middle and high schools. Minnesota is currently undergoing a multi-year transition period. However, the new standards that will be put in motion will not impact the current requirements that K through 8 students receive PE each year, and high school students receive PE at least once. Ohio requires that high school students receive 0.5 units or 120 hours of PE instruction, in which some individual and school waivers are available. And K through 8 schools are required to have a PE curriculum with a course of study, and students should have the opportunity to acquire knowledge and skills to meet those course of study objectives. Other Ohio State Legislature requires that all students are assessed once per grade band, which is noted here on the slide, on the PE benchmarks. Wisconsin requires K through 8 students to take PE, and high school students are also required to take PE, though 1 year may be optional, and they must earn a PE credit for graduation. So now, before I hand it over to my co-host, a quick disclaimer. Please know that the content and views contained in these presentations do not necessarily represent the official policies of the Office of the Assistant Secretary for Health or the U.S. Department of Health and Human Services. I'd like to thank each of you, our participants here in Region 5 and across the country, for joining us for today's webinar. I will now welcome Sarah Chusid, Program Manager at the Illinois Public Health Institute and Illinois Alliance to Prevent Obesity, who will provide some additional context for today's session and introduce our speakers. Sarah.
Thank you, Leslie. We're very pleased to welcome our other presenters today, Dr. John Rady, the Associate Clinical Professor of Psychiatry at Harvard Medical School, as well as Paul Zintarski, the retired PE Department Chairman for Naperville Central High School and a board member of the DuPage Forward Initiative. Just a little background on the Illinois Alliance to Prevent Obesity. IAPO is the acronym. It's convened and administered by the Illinois Public Health Institute, which is a nonprofit organization that mobilizes stakeholders, catalyzes partnerships, and leads action to promote prevention and improve public health systems in order to maximize health equity, and quality of life for Illinoisans. The Illinois Alliance to Prevent Obesity is a multi-sector coalition that works for equitable and just opportunities for Illinoisans to eat healthy and be physically active to optimize their health and well-being. IAPO works through partnerships and collaborations, public awareness building, technical assistance and advocacy to develop changes and implement policies and systems changes to support nutrition and physical activity and eliminate social and institutional barriers to maintaining a healthy weight. We also foster communities and institutions that integrate healthy foods and beverages into physical activity choices, into everyday activities. Just a couple things about PE, some basics. So I want to define physical education, and you can see the definition up on the screen, but it is a planned sequence of developmentally appropriate activities and games that educate students about and through movement. Also, some characteristics of high quality PE, you can see there on the screen, but they're standards based, developmentally appropriate. You have those moderate to vigorous physical activity levels at 50% of class time, follows appropriate instructions taught by a certified PE teacher, and we're talking about developing skills and healthy behaviors for lifelong fitness. And just to really illustrate that difference, and there is a difference between physical activity and physical education, and I like to say it this way. Physical activity is a vehicle to becoming physically educated, just as a book is a vehicle to becoming a reader. However, just as reading skills require teacher instruction beyond the mere presence of books, to become physically educated, students must be taught knowledge, skills, and attitudes to develop lifelong skills for enhancing health and fitness. So with those basics covered, I'm now going to turn it over to our first presenter, Dr. John Rady, who's going to talk about the linkages between physical activity and physical education and adolescent mental health and well-being. Dr. Rady, take it away.
Thank you. It's great to be with you today. I've been an advocate for increasing physical education in our schools around the world, and especially in the US, because I know that what physical education does in physical activity, this slide by Plato says it all. In order for man to succeed in life, God provided him with two means, education and physical activity, not separately, one for the soul and the other for the body, but the two together. With these two means, man can attain perfection. Next slide, please. In our first medical textbook, written by Hippocrates 300 years BC, he wrote about how to treat bad moods, how to treat depression. He said if someone comes in with depression and they are willing, he says, have them go for a walk. If they come back and they're still depressed, he sends them out again. And we learned this early on, and we're learning it again and again and again in a tsunami of scientific studies. One in particular that solidified the use of exercise as a treatment for depression. It was done amongst many done by Duke University Medical School, and this study came out in the end of the 90s, 1999 or so, when they looked at 100 patients who came into Duke over a 4-year period who were complaining about depression. They divided them into 3 groups, put one group on increasing doses of Zoloft, another group they started an exercise program, and another group they did both, exercise and medication. At the end of 4 weeks, all the groups showed being undepressed. This led to a big push in interest, because here was a double-blind controlled study, and it eventually led to exercise being considered a treatment for depression by the American Psychiatric Association. Next slide, please. We know that exercise helps to do many things for our brain. It has the most powerful effect on our brains, especially to help regulate our emotions and to optimize our brain's ability to learn. Next slide, please. We see this slide, we see this fun, we see this play, we see this not today. This is very unusual today. Kids are not playing, they need to get back to it. We need to have vigorous PE programs in the schools to re-educate our children about the joy of movement, exercise, and play. We know that exercise can beat depression, help us keep our mood stable, which is a big problem in our youth today, both with depression and anxiety. A steady diet of exercise in this study out of Norway just this recent year is one of many that shows that we just a little bit of exercise made the difference in these kids and helping them change their mood. Next slide, please. What happens when we start moving on your slide there, the picture of the brain there on your left is a EEG, computerized EEG taken with about 20 kids coming in 4th or 6th grade, sitting down, having their EEG taken. Then they went for a 15 or 20-minute walk, came back and had their EEG taken again. What you see is the difference between the left and the right is more colors on the right after the walk. Colors indicate more brain activity. So in these some 20 people, 20 children, just by having them move, you saw an improvement in their brain's alertness and activity. Next slide, please. We can use the brain, we can affect the brain with exercise, or next slide, we can use our medication, which is too often necessary and too often done. Next slide, please. I've spent a long time talking about attention deficit disorder, doing research, writing books about ADD, and it's quite a problem. 11 to 15% of our children have it, and many of our children, especially in the elementary schools, have trouble paying attention and composing themselves. And exercise is a great treatment for this. Next slide, please. One study that came out recently looking at exercise improving children's executive function, both in inhibiting behavioral problems, and improving their ability to perform on a variety of neuropsychological tests. Next slide, please. What happens when we exercise is we raise the level of neurotransmitters in our brain. The ones that are so important to us, norepinephrine, dopamine, and serotonin, are the targets that we, as psychopharmacologists, look at to try and affect. Well, exercise does it quick and significantly. Next slide, please. The first thing that happens is we increase the level of norepinephrine, which is the alerting, the turning the brain on neurotransmitter. We raise this immediately when we begin to exercise. Next slide, please. Along with that is dopamine, which has so many functions in the brain, but especially reward, motivation, attention, movement, learning. All these are affected by dopamine. Norepinephrine and dopamine are the two neurotransmitters that we elevate when we use our stimulants to treat attention deficit disorder. Next slide, please. Introduce you to my dog, Jack, Jack Russell. As I got Jack early on, I learned that all Jack Russells have attention deficit disorder. Next slide, please. And instead, I took Jack to the veterinarian. The vet said, put him on Ritalin now. Instead of doing that, I devised a very strenuous exercise program for him in the morning. And we'd go out and he'd play and run and come back in, and his ADD was much under control. Next slide, please. It was produced what I call the Jack effect. He could sit and take notes and do his work and stay with it, pay attention, and withstand the frustration of just sitting there. Next slide, please. There were times, however, when I didn't get a chance to get him moving, and this is what we see, and this is what we see in our children too. Next slide, please. Next slide, please. There we go. What we see in kids is this is an early study done in Charleston, South Carolina, where we went into a school that had very little resources, very underserved population, most of the kids on breakfast and lunch programs, very difficult backgrounds, and very difficult school. The teachers were more policemen than teachers. In grades 4 to 8, we were able to get these 120 or so kids to participate every morning in an exercise program in the gym with one PE teacher who set up about 8 stations where the kids would go and spend 8 minutes a time and travel to 2 others each morning. One playing basketball, another station jump rope, another pogo stick, another Dance Dance Revolution. And this led to very astounding results. Compared this semester that they started this to the semester the year before, there was an 83% drop in disciplinary referrals, drop in problems in the classroom, an improvement in cooperation, teacher improvement in satisfaction, and students begin really to do much better on their testing, and their test scores went up. Next slide, please. What happens when we exercise, no matter what we're doing, we turn the frontal cortex on, the prefrontal cortex, the area you see in purple. That's the last area of the brain to evolve. That's the area that's most important for controlling the rest of our brain. We call it the CEO of the brain, Chief Executive Officer, and it's where our executive functions are. And when we exercise, again, no matter what we're doing, we turn that part of the brain on. And that helps in planning, organization, putting the brakes on impulses, evaluating consequences, learning from our mistakes, and especially maintaining our focus during periods of frustration, and improves our working memory. This is the area that we know is problematic in kids with attention deficit disorder. Next slide, please. One of the techniques that we've learned as a useful way to help kids that are having trouble in the classroom, instead of sending them to timeout, putting them in what's called time in. Dan Lawler, brother of Phil Lawler of Naperville fame, came up with this on his own as a principal of an elementary school in Colorado. Instead of having the kids come down to see him who were misbehaving in class, he had various stations where the kids could go and exercise for 5 minutes, turn their brains back on, and rejoin their classroom group. Very effective and very welcome. Next slide, please. I helped start the BOKS program, BOKS, with Reebok, and we're now in 3,300 schools around the country. These are elementary schools, K through 5, where the kids come in voluntarily an hour before school every day to play vigorous games. They've evolved a curriculum, and it's very wildly popular. We're just starting to get results of our intervention, but this is from our first group, about 1,800 kids. We asked questions of after they finished their 12-week semester, and asked them whether they wanted to do it again. This meant that they had to get up an hour earlier before class, before school began, to get to school early, to spend an hour playing vigorous games, 3 to 5 days per week. 96% of them wanted to do it again. And these were both kids from the inner city as well as the suburbs. Next slide, please. The study just came out recently this year in pediatrics, where they looked at about 700 kids, saw that they had significant improvement in participation in school. They had much more positive affect, and much rated very high on feeling more energetic, as well as showing a slight decrease in their BMI as their obesity dropped as well. So this is one of the first of many studies coming out of this group looking at the effect of exercise on kids right from the get-go. Next slide, please. The other studies to support this have been done looking at overweight and obese kids. So they got them on an exercise program to help them lose weight, and what they saw was as their strength improved, as their cardiovascular function improved, so did their mood, so did their optimism, and a drop in negative affect, which is feeling poorly about yourself. Next slide, please. We know from big studies looking epidemiologically that the fitter you are, the more sense of well-being you have. And this is done over men and women, but it will also be the same with our children. They feel better about themselves. They're more confident. They have a better attitude, and they're much more motivated to learn. Next slide, please. What kind of exercise? This information just came out. All kinds. Doing resistance training is important. Playing vigorous games is important. You get a lot of muscle building that way. Doing intervals, which is really what tag or soccer or basketball or many of the sports are about. And lo and behold, all of them lead to an improvement in aerobic training, that you're better, your cardiovascular function is better. And this has a big impact on making your brains work better, as well as helping your mood and your motivation improve. Next slide, please. Unfortunately, this is the way we think of exercise today. That's why we need to get to the kids early and often, and develop in them a sense of competency in exercise, but also the joys of moving, especially as we're being invaded more and more by our digital world. Next slide, please. This is such a problem, and it's getting worse, getting more, we're getting better connections, but easier time being online, and our ever-present cell phone is really making such a big impact. There on your bottom left of your screen, there's a picture from Chongqing, China, a city of 28 million people who have already decided they needed to have the sidewalks, that there were spaces for people with cell phones to walk and spaces without cell phones to walk, because they had so many accidents. But this just goes to show what we're up against, and where I think we need to be with having exercise as a daily part of our diet, of our children's diet in the schools. Next slide, please. I mentioned about ADD, and one of the things we know about ADD is that kids with ADD usually have 2 to 3 times more of a chance of becoming addicted to substances or to activities, more than their peers. So it promotes kids to have more trouble with addictive substances. Michael Phelps, who you all know, had, you probably don't know that he had ADD and was diagnosed at the age of 9, put on Ritalin for a couple years, and as well as mom started him in a swim club, and eventually he showed such promise and began to swim 2 to 3 hours a day. And at the age of 11, both he and his mom decided he didn't need his medicine, because his swimming took care of his changing his chemistry in his brain enough so that he was not such a Energizer bunny, and didn't give trouble to the teachers as he had before. And so they discontinued his Ritalin. Now, what happens with Michael is when he stops training, he is liable to get back into his addictions, and that's been such a problem for him. So that's, and he's a perfect example of having the tendency to take on the addictive substances, and especially in our age today, where we're dealing with the opioid crisis, and other drugs, and even in our digital addictions that we have. Next slide, please. Research is continuing. It's going hugely. We're seeing so many papers out there coming on the effect of exercise on our brains, both aerobically and strength training, and we know that it has a very profound effect. Next slide, please. Exercise increases the level of our endorphins, or our endogenous opioid, in our body and in our brains as well. Next slide. It increases what we call the endocannabinoids, or our own internal substances that act like marijuana. So we have our natural opiates and marijuana in our body. And when we exercise, we greatly increase their concentration, thus helping to prevent addictions, prevent the cravings. Next slide, please. There are times when with Jack, I had the same trouble. He was very prone to addictions. So whenever I would leave for the weekend, I would make sure a dog walker exercised Jack as I had done to prevent him from getting into his addictive habits. However, next slide, please. When the dog walker one weekend didn't show up, this is what I came home to. Jack went back to his addictive ways. So I think today, as an option, not only to improve our kids' weight and physical well-being, but to improve their mental health, their attention, and their proneness to become addicted, that exercise is a useful, wonderful way of addressing these problems before they begin. So thank you.
Thank you very much, Dr. Rady. That was a very interesting presentation. So now this is Sarah Chusip from IPHI. I'm back to talk a little bit more about the particular work we've been doing around enhanced PE here in the state of Illinois. So next slide, please. So the origin of all this. So really, a lot of the enhanced PE activity in Illinois has been taking place since 2011. So in 2011, the Illinois representatives from the Illinois State Board of Education, Illinois Department of Public Health, and the Illinois Public Health Institute were invited by the Centers for Disease Control and Prevention to review a set of evidence-based interventions recommended by in the CDC's Guide to Community Prevention Services, and you can see a picture of the cover of that on the slide. So the delegation saw enhanced physical education, which is an intervention that entails primarily increasing the length of or activity levels in school-based PE classes to get those moderate to vigorous physical activity levels up to 50% of class time. So they saw the evidence that shows that if you get those levels up in PE classes to 50%, you see a reduced risk of developing chronic disease. That, in combination with some of that neuroscience that Dr. Rady helped develop, was very compelling and led them to decide to come back to Illinois and promote enhanced PE in the state. So that led to several changes over the last few years, our journey to high quality enhanced PE in Illinois. So first of all, they launched this multi-year sequential effort to promote enhanced PE throughout the state. That involved, at the outset, convening a voluntary task force of stakeholders in the public health and education realms to develop a strategic plan. And the vision of that plan is that all K through 12 students in Illinois have access to high quality enhanced PE. So they developed that plan, and continuing advocacy led to two new laws in this state. So one of them was a law to revise the state learning standards to integrate enhanced PE approaches, and that involves not only getting physical activity levels up to 50% of class time, but shifting away from an emphasis on sports and competition to health and lifelong fitness. So those standards were revised and went into effect in the 2015-16 academic school year. It also brought Illinois into alignment with current best practices at the same time in our state learning standards. And then the second law was a new law requiring health-enhancing, health-based physical fitness assessments be administered to all K through 12 public school students in the state. And the purpose of that is to measure the impact of our state goal 20, which is that students achieve and maintain a health-enhancing level of physical fitness based on continual self-assessment. And also one last, two other things I'll talk about. One of them is, as of last year, it is now required that districts report the average number of days that students are getting physical education in their districts on our Illinois school report card. So that information is now publicly available and will help parents and the communities understand how much PE students are getting. Now, a note about daily PE. So since 1957, Illinois had a daily PE requirement here in the state. In many ways, a lot of our PE work was off of that daily PE requirement, which was unique. Other states have kind of a minutes, an equivalent, but they didn't explicitly state daily PE. But that was changed as of last year. So as part of coming to a bipartisan compromise to pass school funding reform law, the daily PE requirement was changed as part of that compromise. So now our current requirement, as Leslie touched on, was that schools and districts must provide a minimum of 3 days per week and up to 5 days per week of PE. So the Illinois Alliance to Prevent Obesity, we would like to strengthen that PE requirement. We would like and are advocating to bring Illinois into alignment with the recommendation from the Centers for Disease Control and Prevention and Shape America, which is that students be provided for elementary schools 150 minutes of PE per week minimum, and for secondary schools 225 minutes per week. That's 225 minutes per week. And it is the position of public health advocates, including IAPO, including the American Heart Association and the Illinois Association for Physical Education, Health, Recreation, and Dance. The acronym for that is IAFERD, and that is the Teachers Association, that Illinois adopt this minutes per week standard. And the reason is the minutes per week policy would provide districts flexibility to plan and schedule PE as makes sense for them, and having kind of local control is a really distinctive feature of Illinois and our school system here. But also it would give them flexibility while ensuring that students are getting the recommended amount of PE per week, because PE, as we've talked about, is a key opportunity for physical activity, as well as the skill building and fitness and health education that benefits them throughout their entire lives. So I just want to quickly touch on a program that the Illinois Public Health Institute developed through funding from the Centers for Disease Control and Prevention. And it is a professional development program we've been offering for 3 years. It is called Pump Up PE, Promote Health, Learning, and Lifelong Fitness. This day-long training program, and there are also half-day versions and custom technical assistance that we offer through this. But it is a professional development program for PE teachers on how to implement high-quality enhanced PE programs to prepare students for a lifetime of health and fitness. This program was, as I said, CDC funded. It originally started in suburban Cook County, but through additional funding from the Illinois Department of Public Health, we've now been able to take this program statewide, and to date, we've delivered it 56 times to over 1,000 PE teachers across the state. Next slide, please. This program was independently evaluated by the Consortium to Lower Obesity in Chicago Children, and it was found to produce, in combination with other types of professional development, statistically significant increases in those physical activity levels in classes, as well as teachers reported confidence in their ability to implement these new policies. So that's a snapshot of what we've done in Illinois, and now I'm going to turn it over to Paul Zintarski from Naperville to talk about some of their groundbreaking and globally recognized work they've done.
Thank you, Sarah. We were fortunate enough to have Dr. Rady come to visit us and started me on a journey of understanding how exercise and fitness affected the brain. And using this research, we started to collect data. And our data looks something like this. We had a class called Academic Reading Intervention. This was for students who were reading below grade level coming to our high school as freshmen. And we really didn't keep any data at first. And my principal had come and asked me if I would consider running a 0-hour PE class before school for students who were in this particular class. And having spent time with Dr. Rady and understanding, I said, absolutely, but the next class has to be the academic reading class. And so we did that the first year, and eventually it evolved to where we had 4 what we then called learning readiness PE classes throughout the day, because we had 4 academic reading classes throughout the day. And so from 2005 to 2010, you'll see what our data showed. Students who did not have benefit of the learning readiness PE class just before the reading class improved 9/10 of a grade level equivalency in a semester. That's pretty significant because reading scores are hard to improve. However, the kids who had benefited of the PE class improved 1.4 or half a year more. So we did that data over those 5 years through the course of a semester. And in 2011, after I retired, I said, let's carry out the study for a whole year. And as you see, the students who did not have benefit of PE improved almost 2 full years of reading improvement. So we know the intervention worked, but the addition of the PE class before it added another full year. And this data was collected using the Nelson-Denny reading test, a nationwide acceptable reading test. Next, please. Our math department wanted to get involved after the first year, and they used a test that they call getting an algebra ready test. A class that we had at our school was called algebra ready because these were students who were not ready to take algebra as freshmen. And as we placed learning readiness PE classes throughout the day and put students in the class, so the students involved in the class were all needing the algebra intervention. And again, you see the data. Students who had the PE prior to having the algebra ready class did 93% better than those students who just went to the introduction to algebra class. And so that's data we collected. So we now know that physical education can be used as a tool to increase learning in all kinds of students. Thank you.
Thank you, Paul. So just to sum up some of our key messages, but as you've seen here from all the research, physical activity is associated with improved academic health and behavioral outcomes among students. It is shown and proven, and there's an evidence base that demonstrates that it lowers the risk of chronic disease. And movement prepares learning for the mind for learning. And finally, PE is so much more than just physical activity. It provides students with those skills, knowledge, and competence for a lifetime of healthy habits and fitness. So thank you to all of our excellent presenters. Right now, we want to open things up for questions from you all. So if you want to go ahead and take a few moments to type your questions into the chat box feature, I'm going to give you a few seconds to get your thoughts together. And then we will open it up to our presenters here to answer your questions. All right, so go ahead and type your questions into the box. We do have one here. I think it's a little bit in jest. Dr. Rady, people are wondering if Jack is doing well now. I don't think you really have to answer that one. Okay, we have more questions coming in. So this is for everybody. Speakers, let us know if you feel like answering this. What is the best way or the first step to bring this to school administration if we're interested in enacting at our school? As our speakers unmute themselves, I definitely, this is Sarah from IPHI, would say that here in Illinois, when we first started enacting our laws around enhanced PE, so the first law to revise our state learning standards, it actually had two parts. So it created a task force called the Enhanced PE Task Force. And that task force's job was not only to revise the state learning standards, but to come up with a plan to promote enhanced PE in Illinois. So as part of that, the task force was composed with representatives from all levels of the school community, including the Superintendent's Association, the Teachers Union, all that kind of thing. So really representatives from the administrative level. And they crafted sets of messages that they felt would be appealing to their peers. And one of those was, the main thing was educating your school leadership about that connection between PE and PA and learning outcomes among students, especially the academic improvements. And that is because we all know that school leadership districts are very concerned with test scores. I'm sure everywhere, definitely here in Illinois. So learning about that connection is one of the biggest steps and messages that you can do to make administrators understand why this is valuable, why all this work has gone on with PE, and why it should be supported in such a way. So I gave you as a handout in your sidebar our enhanced PE fact sheet, which has some of those great bullets and some of these messaging points aimed at school leadership. It has a picture of those brain scans that is so just powerful. So I really encourage you to do this. We also have a few more webinars on our website, iphionline.org, that were geared toward how to talk to school leadership, some of those additional, just kind of expanding on these messaging points. But that is what I would recommend. Presenters, do you have anything further to add, or anything, Paul, that you would have to say about this?
I would say it's important for physical education teachers to figure out ways to create data that makes sense to administrators. Administrators' feet are held accountable to the stone only by test scores. So if you can show that using physical education to improve test scores and to improve education is a way to promote our subject going forward. We just need to do that. We need to bring back education into the physical education realm, and we've spent too much time worrying about moderate to vigorous movement without understanding that, one, we need to educate our parents and administrators, and especially our students, about the value we bring to the table in terms of the mental health aspect, as Dr. Reddy discovered or discussed, and as well as improvement in academic performance.
Thank you, Paul. All right, another question coming in. With all the data and research showing the relationship between activity and academic performance and behavioral performance or behavioral issues, what would you recommend schools and PE teachers do locally to show the impact of the programs within their schools? Well, I don't know if one of our speakers has something to say off the bat. I definitely have some thoughts to contribute.
Let me just say this. I mean, the idea of educating and publicizing the effects of exercise is really powerful, and especially if there's a special program in the schools that started, or hearing about it in other schools that are using more physical education time or physical activity. And they have seen gains in their improvement in their test scores, improvement in the kids' grades, improvement in all the things that the administrators worry about, but also improvement in their emotional side of things, less anxiety, less drug use, all that is really going to be the way of the future to really convince anybody that this is a useful program. So how you do it is using the media now is great, and letting people know about these things. I mean, every day there are articles. Well, I have a website, Facebook page, John Rady MD, where every day we put up a new news article on the effect of exercise and activity on kids and adults, but mainly focused on the schools because it's worldwide effort, worldwide understanding to promote getting our kids back to moving.
Yes, thanks, Dr. Rady. And one thing I'd add, and Sarah from my PHI again, is that, we just started doing fitness testing last year here in this state. So for the very first time at a state level, we're going to have information on the state of the health of students across our state And even just doing that, it's just this huge accomplishment. So we have a saying in public health, what gets measured gets acted on. So the fact that it's there, it is publicly available, we're really just at this beginning point where we'll have the data coming in, and then we'll assess it. We're figuring out, what do we do with that? How do the teachers move students forward and along on that spectrum to a higher state of fitness? One thing we've been careful about here is to really acknowledge, though, and to discuss whenever it's communicated with districts and communities about fitness testing, is that definitely cognizant that many factors influence students' health and their state of fitness outside of what happens in PE class. So in fact, we have it written into our law that you explicitly cannot evaluate teachers or grade students on their fitness scores, because it is about just setting goals for improvement and continual self-assessment over time. So of course, the overall goal is to measure our impact of our state goal 20 and get our students into a higher state of fitness. But really, one thing we're doing as far as showing impact of PE programs is really doing a lot of messaging around how have schools and districts moved to implement these new policies to shift their programs to this enhanced PE kind of perspective, and really communicating with the entire school community about the fact that schools are now moving towards standard-based curriculum. So one thing they might do is to post the standards in their gyms. Part of why we have state learning standards is that so students understand what is expected of them and where you're trying to move forward as far as their fitness education. So that kind of thing, definitely getting the entire school community to understand that link between movement and improved health and academic outcomes so that they are supportive. So really, it's been a whole messaging campaign here about why are we doing this? Why are we enhancing PE in this state? What are the overall and long-term kind of improvements we expect to see? And really just moving that all forward as we are embarking on new chapters in what we're doing here with PE. Does anyone else have anything further to add on that? I would also say before that, we have a specific webinar on our website, iphionline.org, about how to engage parents and community members to communicate about enhanced PE programs. Anything from any other presenters on this question?
Just echoing what was already said, it's really important to educate our parents and our students as to the value physical education brings to the table. I have never met a parent who doesn't want their student to be successful, but they don't have this information. So it's our job as a physical education teacher to give them the information about what value we bring to the brain, what value we bring to the emotional stability of our students. We're the only subject in school, because of what we do, that covers all 4 domains of a student: socially, emotionally, physically, and now we also know mentally. So in all essence, we are the most important subject in school. We just need to talk about it. We need to educate people about it. We need to educate the school staff about what value. We're, at the elementary level, we're better than just being a potty break or a coffee break for the classroom teacher.
Yes, thank you, Paul. And that's something we're emphasize every single time we do anything on PE, and that's why we put in the slides on even that definition. What is physical education? How is it different than physical activity? And what all is involved in high quality physical education? So definitely encourage you. We gave you the slides as a PDF, but some of that content as far as really even sharing this definition, that's what we're finding in our movement now here in Illinois for over 5 years, is just a lot of that basic education to everybody from administration to parents to students themselves about what is involved in high quality PE and how much value it brings. So thank you. All right, so another question. Got a question like why would the state of Illinois pass legislation to change the PE requirement? We went from daily PE to now minimum of 3 days per week with all that's going on with the enhanced PE movement. So it's a great question. And I would say this, is that as you all probably know, whenever some kind of major piece of legislation is passed, here there was a deadline around school funding reform. And sometimes when you have large bills like that, other things will get thrown into it. Kind of, it's a last minute crush that happens when you're passing some large piece of legislation. So there were a few legislators who wanted a change to daily PE. And I really just think it comes down to, it may be that particular legislator's position about PE. Sometimes with our daily PE requirement, it is something that would be kind of be on the chopping block or under threat each and every year. Each and every year, we had to rally our networks of physical educators, of PE teachers, of school leaders who understood where we're going with all this, and make sure to convey and really fight to keep that requirement in place. And I would say, and so this happened, it was part of the school funding reform, and definitely our point now as IAPO is to say it definitely does run counter to all that we've been doing in the state for the last few years. And our position now is to strengthen that back up. And we do ultimately feel that a minutes per week in some ways would be a great replacement policy because it is in line with CDC standards, and it would ensure that students are getting that minimum amount of minutes while giving districts that crucial flexibility, which I think was part of the discussion here. As schools are dealing with across the nation, they're feeling a lot of pressure as far as so-called mandates, just different requirements of them. And we're always really careful about how we talk about PE in this regard, because it is our position that PE, of course, is a core subject just like math or English and should be treated as such. But we really are just going to continue this education with legislators about all that we've done and why we have gone forward and why we have enacted these policies recently, and definitely wanting to have a strong policy in place of the changes to daily PE. So I don't know, if, Paul, if you have anything to add, but that's kind of IAPO's position on it. And it's just our view that we're going to move forward to something stronger.
Yeah, I agree with everything you said, Sarah. It's unfortunate we had that law that came through, but now we're back to fighting it, and we're close. I mean, Senate Bill, what is it, 2572 is on the table. It's come out of committee, and it just now needs to be approved by the state Senate, which will set the minutes that students are to have PE. And in some cases, especially at the elementary level, 150 minutes of PE will be greater than a lot of districts did for years when they asked for waivers.
Great. All right. Let me just thank you, Paul. Looking through the questions, we have time for maybe one or two more. Let's see. How do we get kids to buy into all this? How do we compete with technology? We're noticing that our students are becoming less and less interested in physical activity and more interested in their phone. So one thing I'll say just to kick us off is that a big part of what the revisions to our standards and kind of what we're emphasizing in our training, Pump Up PE, is student buy-in. Part of it is just really explaining the why. That messaging points that's in the enhanced PE fact sheet applies to students as well, which is, and I love one thing Paul says, it's like, I build brain cells, you fill them. So, understanding that physical activity has all these, will be associated with improved health for them, with improved academic performance. Really a lot of teaching about what is going on with your body. Why do you want to get your movement levels up to the MVPA level? And just really understanding the lifelong health, just really teaching them the why and what's going on with their bodies is something we're trying to do. Anything to add from our other presenters?
We have to remember that exercise in and of itself is not fun. Anybody who's told you that exercise is fun has lied to you. It's work. And so we just have to keep encouraging our students that they need to do this for their lifelong health and wellness. Have an out of the way thing is have them go visit a nursing home sometime and look at the people sitting in the hallways in wheelchairs with their mouths open, in a stupor state, and say, if you don't want to end up like that, then you have to start exercising now and keep exercising the rest of your life. So, I mean, it is a tough task, but it's a task we need to continue to handle. And we can't just be about fun and games anymore in physical education. As I said, we have to bring back the education part to physical education. We just have to keep educating people, parents and students about how important we are.
Thanks, Paul. With that, we are at 12. I'll say one last thing. I got a question. Where are the webinars housed? That's on our website, iphionline.org. That's iphionline.org. On the right-hand side, you'll see a resources tab and webinars, and you can access all of our PE webinars there. And with that, I'll turn it over to Leslie to close us out.
Thank you, Sarah, and thank you, Paul, and thank you, Dr. Rady. Thank you all for your thoughtful questions. We greatly appreciate the helpful information our expert presenters have shared today. As Sarah mentioned, our webinar was recorded in the archive, as well as presentation slides will be shared out soon. A special thanks to IAPO, the Illinois Alliance to Prevent Obesity, for hosting today's session, as well as sharing their journey and expertise. And a special thanks to each of you, our participants here in our Region 5 states and across the country, for joining us for today's webinar. Have a great afternoon, and we'll be in touch.